Our job is to identify, engage, and enroll 1 billion consumers, 80 to 90% of whom are undiagnosed, to better sleep and better breathing so they can change their lives, have better outcomes, low risk of heart attack and stroke, and a better quality of life.
Welcome to Seeking Alpha's CEO interviews, informed conversations with the best and brightest CEOs in the publicly traded markets. Quality of leadership is a decisive factor in stock performance. Our show provides intimate and in-depth investing discussions with industry leaders across all sectors of the marketplace. We publish excerpts on social media platforms and the full conversations on seekingalpha.com or on our highly rated Seeking Alpha mobile app under CEO interviews.
Welcome back to Seeking Alpha. I'm Josh Kincaid, capital markets analyst, and today interviewing CEOs. My guest today, Mick Farrell, CEO of RMD. Mick, thanks for being with us at CEO Interviews.
Happy to be here, Josh, and to talk about ResMed and all that we do.
Let's talk about it. You guys are on the New York Stock Exchange under ticker symbol RMD. ResMed, you guys are developing, manufacturing, distributing, and marketing medical devices and cloud-based software applications for the healthcare market. So you guys operating in two segments, sleep and respiratory care. Software as a service. ResMed was founded in 1989, headquarters in San Diego, California. So I got to ask you the question, Mick, I just bought a bed for $4,000. When did sleep become big business?
You know, it's interesting. ResMed stands for respiratory medicine. So it can also stand for residential medicine. But sleep has always been an important part of someone's life. It's 33% of your whole life that should be spent in this beautiful, unconscious state of regeneration of body, mind, soul, and spirit that happens during sleep. So sleep is an essential part of life for all mammals, but particularly humans. We regenerate all our synapses, delete the stress from the day before, come up with new ideas. Newton came up with the theory of gravity on a nap under the apple tree at Cambridge. Einstein came up with the general theory of relativity after a daydream nap at the patent office. Archimedes fell asleep in the bath and then came up with the theory of displacement. So your best ideas come after a good night's sleep. Sleep's essential. Charging $4,000 for a bed sounds like a lot. Hopefully you can keep that 10 years and depreciate it for $400 a year. What we do is we take care of not only sleep, but also breathing. That's the respiratory part of respiratory medicine. So sleep apnea, which is Greek for without breath, apnea. I prefer to say sleep suffocation. And there's 1 billion people worldwide who suffocate every night while they sleep, and they don't know it because they're in that unconscious state of sleep. Their bed partner knows it because they hear the snoring and the silence and then the snort as they come back from their apnea. Our job is to identify, engage, and enroll 1 billion consumers, 80 to 90% of whom are undiagnosed, to better sleep and better breathing so they can change their lives, have better outcomes, low risk of heart attack and stroke, and a better quality of life.
Sleeping is important, not to make light of it, but if anybody's has a puppy or a newborn, they know what sleep deprivation is. I had shoulder surgery back in August and haven't really slept well in the last 6 months. And it affects you and it affects your partner and affects everything. Sleep apnea is one of those things. I think you started that, your position. I mean, you've been with the company for over 2 decades, and you were part of the global sleep apnea team, I think back in the late 90s, maybe. And so you've got a good grasp on this. I would call it an epidemic because I'm not aware of it, but it's impacting family and friends. And I'm seeing this, and I don't know if they all seem to be heavier set. So I don't know if it's a matter of obesity or the sign of the times. Can you maybe explain sleep apnea and how it became so prevalent and maybe some of the causes around it?
Yeah, look, I mean, the epidemiology of it is very interesting. I mean, as I said, it's 1 billion people worldwide. It's not just people with high body mass index. It's not just those with a large neck or, central obesity. It's, in fact, incredibly common. And that's what the trouble is. I think the stereotype is it's a middle-aged, centrally obese male. And we are now seeing 40% of the patients through our diagnostics channel are female, and it shows up far more subtly with women. And it's not just those with high obesity. The reason humans, as the mammals we are, have sleep apnea is we have this ability to vibrate our tongues right near our uvula. This thing that I'm doing that sounds like an Australian accent to you comes across as speech. Our tongues, as we evolved as humans, moved back towards the back of our throat to create speech. That's how we beat the other humanoid that were there at that time. And what that means is, as the tongue goes back, we get this great ability to speak, create language, history, and philosophy, and all the things that humankind has done. The downside of that is that humans suffer from sleep apnea, and most other mammals don't. And so the difficulty of it is genetic. It is your DNA, and it's like your risk of cancer or your risk of many things. It's driven mostly by your DNA. And so if your tongue and your uvula and the shape of your upper airway are a certain way, it doesn't matter how much you eat or drink, or if you exercise very well, you may end up with sleep apnea. And that's been our job, to move away from the 80s. It was stereotyped as a fat middle-aged male disease. It is not. It is very prevalent, and there's ways with simple screening technologies, like just a phone that could have some sonar technology at night from an app that can listen to your sleep, and then can find out if your breathing patterns, your sleeping patterns are indicative of having sleep apnea. And that's our job. It's literally a sleeping disease. And our biggest competitor is ignorance. It's lack of education and awareness about that disease. So helping 1 billion people find their way to, do I have a sleeping problem? Is it associated with just insomnia, one of those sleeping disorders? Or is it associated with a sleep and respiratory issue around sleep apnea? It's very common, and our job is to help uncover that, so that there's a simple treatment. People can find their path to better sleep, better breathing, and a better life.
Do you still find that people are approaching you thinking that it's just the mask and the clunky machine that makes a lot of noise, and that technology hasn't advanced, even though wearables are kind of telling us about our sleep patterns? Or are they shocked or surprised to find out that there are other devices or alternatives or technologies to help with the situation? Or are you finding that a lot of them just don't even ask because they assume that it's just that old school technology?
It's an interesting one, and people don't like to have any type of medical issue. They don't like to have high blood pressure or high cholesterolemia, so people often don't seek therapy. So what you have to do to overcome those biases, to not seek any medical treatment, is show the other side. And so what we really focus on is not the treatment or the therapy. And there's a variety of there's the CPAP, as you say, has a mask that's as small as my finger under the nose now. They're smaller, quieter, and more comfortable than ever before. But we focus on the fact that when you wake up, you will wake up refreshed, probably for the first time in decades. You will have better IQ. You will do better at your job. For me, I'll be a better husband, a better father, a better CEO, and you'll have better outcomes in terms of long-term outcomes, reduction of risk of heart attack, stroke, and improvement of your quality of life, from being a better sports person, for me on the tennis court, for you as a journalist, and for all of us in our lives, in our vocation. And so that's what we focus on. There is a stereotype that it is, your grandfather's CPAP, if you like. We have made them smaller, quieter, more comfortable, and more cloud connected. And that's a big part. We now have 5G chips, comms chips in every single device. We send the data to the cloud and we put it in your smartphone. So every morning a patient wakes up and they get a score out of 100 telling them how they slept, how they were breathing, and it's gamification, and people get involved in their therapy. And there's actually groups out there talking about their better sleep, their better breathing. And that's what we're doing. We're focusing on better outcomes, lower costs for the healthcare system, and improve your quality of life. And yes, there are therapies. And for the CPAP, the main one, the non-invasive one, you do have to wear something externally every night. But it's literally the size of my finger now, the nasal pillows masks. And the device, our AirSense 11 is the latest one. It's so quiet. My wife, I'm a personal user. My wife asked me, she says, is that one even on? Because it's that quiet and that silent. And of course, eliminates any snoring and snorting. So the bed partner loves that device. But there are alternatives. We make a 3D printed dental device in Europe, and we also have hypoglossal nerve stimulation, an implant device. Far more expensive, and really you've got to try the non-invasive, then the dental, and then the surgery. But there are many alternatives out there. The big opportunity though, Josh, let people know there's a path to better sleep, better breathing, and a better life.
So RMD, you guys have markets producing primarily for sleep clinics, right? Not residential, but you have home healthcare dealers, you have hospitals through a network of distributors and direct sales force in approximately 140 countries. So it's not residential, but do you guys incorporate insurance or equipment leases, or is this simply a direct sales? How do you describe your revenue model?
Yeah, Josh, it's good because as you said, we operate in 140 countries worldwide. In the last 12 months, we helped 133 million people sleep better, breathe better, and live a better life outside the hospital. So it really is residential medicine in that the 16 million 100% cloud connectable medical devices are on people's bedside tables in their home. And so we are engaged. ResMed is residential medicine. We take care of 95% of our revenues are for outside hospital care. So we want you to get diagnosed and treated in a doctor's office, maybe a hospital, but preferably an outpatient clinic for a sleep lab, or maybe even home sleep apnea testing. Your COPD, maybe from a pulmonary doctor, or asthma from a pulmonary doctor, an outpatient. But then you get recommended a device that you take home, and it's cloud connected. And for CPAP, as we've just been talking about it helps you sleep better and breathe better. If you have chronic obstructive pulmonary disease, another 300 million people who have lung disease that we take care of with a ventilator or a cloud connected inhaler for the medicines that you need to get into your lungs with COPD. Those are either operated or taken in the home or on the go. You take those cloud-connected inhalers wherever you go. And the same thing for the asthma part of our business. As you in your intro, you talked about our software as a service business. That is all out of hospital care as well. We run software as a service for home medical equipment companies, for home health, for hospice, skilled nursing facilities, private duty home care, and all of that is residential medicine. So our revenue model is probably dependent on each of the countries. In the United States, it's probably around 90% insurance and 10% private pay. But you flip that round to a country where I was, grew up and educated in Australia, where there's no government reimbursement for CPAP. It's probably about 80% private pay and 20% insurance pay. ResMed, our job is to find, no matter what the clinical model, the economic model, the insurance model, our job is to help people who suffocate find a path to sleep apnea treatment. People with lung disease find a path to COPD treatment. People with asthma find a path, and all those need out of hospital care can find a path to better care. So we can help you if there's an insurance market, find a path to market, and we can help you in a consumer market to it. What I'd call it really, Josh, is an omni-channel approach to helping people get their path to better residential medicine, better respiratory medicine.
With that data you're getting from the cloud, what kind of analytics are you able to pull from that? Are you using any ML and AI in order to get some more reports and use research coupled with that to gain any new insights?
Absolutely, Josh. It's an incredible amount of data. We now have over 10.5 billion nights of medical data in the cloud. And what that allows us to do, and look, I want to lead with this: privacy, cybersecurity, and being a steward of the data, knowing that, Josh, you own your own respiratory rate and heart rate. We are stewards of that in the cloud. So I really want to differentiate medtech and what we're doing with digital health and big data from consumer tech and, what Facebook had to rebrand their whole company to Meta because they turned the person into the product and they bought and sold their data. We don't do that. What we do is we liberate the data to the cloud, 10.5 billion nights of data. We do use artificial intelligence, machine learning to gamify that data, but it's your data. We give it to you in an app called myAir that the patients, 4 million patients are on myAir. They get their data every day. I talked about the score, the myAir score every day out of 100, but there's so much more to it. Coaching and individualizing personalized medicine for that individual to help them engage more in their sleep apnea care. We're also applying that to the doctors. We have software called AirView for the physicians. They can then look management by exception over thousands of patients, maybe tens of thousands of patients, and they can interact with their patients digitally. And the final part of it is we can do population health management. We published a study just this last quarter where we worked with the French government, where it's really, think about it as Medicare for all in France, right? Their social security system provides healthcare for every single French citizen. So we took de-identified data from our 10.5 billion nights of data with French Social Security data around patients who were on CPAP and those who were not on CPAP, non-adherent. And what we were able to show by using those de-identified data is that CPAP adherent patients, patients on ResMed sleep apnea therapy, it's called CPAP, they had a 39% reduction in mortality. I mean, you talk about life and death, a 39% reduction in the rate of death for patients on CPAP versus the control group, those who are non-adherent to CPAP therapy. Now, for the French citizens and the French doctors, that's amazing, 39% reduction in death. Everybody should get screened and diagnosed and treated for sleep apnea. The other part, for the French accountants and the healthcare system managers, it lowered hospitalizations and costs. So we save lives and we save money. That sort of big data analysis using AI and ML to engage patients is great. Showing under population health management that we can save lives and save money, that the billion people that suffocate should all be diagnosed and treated. I think that's one of the biggest opportunities that we can do here. Sleep apnea is a bigger problem than smoking in its impact on the world, but it doesn't have the same reputation and the need for smoking cessation. Great programs in the last 20, 30 years, right? What are we doing about this other respiratory disease called sleep apnea and this other one called lung disease or COPD? That's our biggest opportunity, to use the data and AI and ML to uncover truths like that.
I'd like to take a look at, switch gears, take a look back at the last couple of years, and just ask how you've managed to remain a financial going concern, how you've been able to pivot, continue your first mover advantages. ResMed, you guys mentioned the cloud connected CPAP machines equipped with digital health technologies and using to treat sleep apnea. The cloud connected ventilators and digital health technologies are using to manage COPD and other respiratory diseases in a network of out-of-hospital healthcare management solutions designed to help providers deliver more personalized care, measurable results, and improve health outcomes. COVID, however, affected the business landscape globally, creating opportunities for some and losses for others. The disruption owing to the pandemic has also led to the supply chain issues for many businesses, including ResMed. Respirators were in short supply as of Q2 2020. How did the pandemic affect your business?
Yeah, Josh, it's a great sort of multi-part question if you think about it, because COVID has had, what are we now, 24 months into the COVID-19 crisis, and we've seen so many waves. In that first wave, as you said, ResMed pivoted immediately. And in fact, we have a manufacturing facility in Shanghai, just outside Shanghai, a city called Suzhou. And we saw the demand for our Suzhou ventilators pick up exponentially in January 2020. So Wuhan, the Hubei province, the first outbreak of COVID-19, we were shipping ventilators there in January. So we almost had a front row seat to seeing this. And ResMed was there in 2003. As you said, I've been with the company 20 years. I was there in 2003 at SARS-CoV-1. And so when we saw that signal, Josh, we knew that there was going to be a surge of the need for ventilators. And so we tripled and then quintupled our manufacturing of the Astral flow generator. And we did 350% of our total ventilator pool. So Astral, Stellar, these are the brand names, AirCurve. 350%. We made 150,000 ventilators from January 1 through to June 30, 2020. So we pivoted our whole business on what's just a small portion, a single-digit portion of our business for that, I would call, acute phase of the COVID crisis. We're now beyond that. 2 years later, our demand for our ventilators is back to sort of 2019 growing levels of normal needs for COPD, neuromuscular disease, respiratory insufficiency, where we take care of those patients. But that ability to pivot our whole company was very useful, because that supply chain stretch that we did to do 350% and then 500% for ventilators is a lot of learning, because now we're in the next phase of the COVID crisis, right? So we have patients starting to come back to hospitals, starting to find digital ways to get home sleep apnea testing and home telemedicine and telehealth to get diagnosed with sleep apnea, COPD, and asthma. So that's sort of slowly and steadily recovering. But then we have the supply chain crisis. Hit every single industry. Semiconductors particularly are in short demand. We have automotive companies, Tesla, Ford, GM. We have consumer companies in cellular comms like Samsung and Apple, all demanding these semiconductor chips. But what about us? Medical devices. We're less than 1% of the total demand, And Josh, I'll ask you this question. Does the world need one more electric car, one more, cell phone, one more cloud-connected refrigerator, or does it need one more medical device that can give the gift of breath and stop someone suffocating, keep them out of hospital, and ultimately save their life? We obviously think it's the latter. And so we're moving out there in the supply chain crisis to pivot ResMed to move further and further up the supply chain to get those parts, to re-engineer the supply chain, to get new suppliers, to re-engineer our products, to change components so we can get supply, and even to introduce new products like we have with the Essence 11 so that we can get more and more supply. So we're moving them forward on that. And, we just finished our December quarter, Josh, and announced our numbers, and we had great 16% growth year on year in our devices. That's not enough because we have almost infinite demand, because in addition to COVID recovery and the supply chain, one of our competitors had a major recall of 5 million devices in the space, and we're trying to fill that vacuum. We were the number one player. They were the number two player. We now have to be the number one player and the number two player. So it's almost like a perfect storm. COVID recovery, supply chain crisis, and now a competitor recall. But Josh, I've seen the resiliency of the ResMedian team, 8,000 of us in 140 countries. We did it with the ventilator surge and doing 350%, 500%. We're doing it again now and ramping up our core market. We're going to take care of patients throughout calendar year 2022 and beyond while our competitors are out of the market. We're going to help people sleep better, breathe better, and do everything we can to take care of every patient that gets diagnosed through the system.
Are patients as resilient as ResMed? Because as you mentioned, Philips had a recall. There was millions of sleep respiratory care products that were recalled. And so you guys announced that it was safe to use yours. That wasn't affected at all. They had over 5 million globally. Philips had over 5 million devices recalled. And the FDA asked them to conduct more tests for those recalled ventilators. The impact, I'm curious to kind of unpack that. I wanted to know what the impact was. You mentioned it opened up the opportunity to grab more market share. Can you elaborate on that?
Yeah, Josh, look, I first start with the humanitarian side of it. I mean, it's really sad that 5 million people will need to have their, that competitor's device replaced. So it was CPAPs, APAPs, bilevels, and ventilators. It was across sleep and respiratory care that they have this recall. They announced it in June 2021, and they just said just this week that it's going to extend all the way through to December 2022. So that's 18 months that they're out of the market to help new patients. And for us, what that means is we have to step up because, as you said, those patients are still getting diagnosed, but the doctors are finding a way, even during COVID, with cleaning protocols to get the patients in. And so we're seeing the flow of patients start to come back, probably 85 to 100% of pre-COVID flow of patients. And ResMed is doing everything we can to take care of those new patients coming through. Look, it's Philips' job to take care of the recall. They have to go and do their 5 million patients, repair, replace, and take care of them. But for those 18 months that they can't be there for new patients, it's ResMed's job really to be the number one player as we were before, but also the number two player and help as many patients as we can. That backlog of patients is building. But as I said, we are freeing up our supply chain. We're re-engineering the supply chain. We're re-engineering our products and introducing new products so we can do our best. It's really not about taking market share. It's really about taking care of patients, and the market share comes after that. The important part for us is that as we engage patients with myAir, doctors with AirView, and healthcare systems with this ecosystem of digital health, we're not just taking care of them for the short term. We're managing them for the very long term. So I look at the market share we're getting, and I'm saying, well, we're going to maintain that forever. But I'm not really looking back and saying, what's our competitor doing with the recall? I'm looking forward and saying, what about our partnership with Google, sister company Verily, our joint venture called Primasun? What are we doing to digitally identify, engage, and enroll patients into this so that when we get to the other side of this crisis and we need to get to the billion patients, how do we get people who are just Googling my husband snores or my wife snores, what do I do about it, to find a solution and find their path through? What are we doing with CVS? We have a partnership with CVS Health, and they have, 80% of Americans are within 8 miles of a CVS store. What are we doing with brick and mortar and pharmacy and CVS Health to identify, engage, and enroll people? We don't need demand gen here in 2022 because of the recall. We've got those 12 months of just, pretty much be the number one, number two player ourselves. But when 2023 comes, our competitors back, how do we make sure that we continue that demand generation and really focus on the billion people, 1.5 billion, including sleep apnea, COPD, and asthma, that need our help?
One more question about the economy and how you remain resilient through it. We saw that the market faced really high demand for sleep respiratory care devices, as well as continuing to recover from a lot of markets, COVID coupled with supply chain constraints impacting not only the industry, but a lot of industries worldwide, like you mentioned. Philips, they dropped dramatically due to their growing recall of CPAPs and other respiratory devices, as well as the continuing supply chain issues impacting the medical device industry. The near-term supply chain issues likely to weigh on RMD's earnings. Maybe you could talk about that. Headwinds likely to ease from Q4 onwards and provide RMD with a clearer runway and to capture some more market share. But can you elaborate on the supply chain constraints and how you were able to mitigate those challenges?
Yeah, Josh, well, it's a complex equation, right? Because, we operate in 140 countries. We also source from, many countries around the world, our parts and pieces. And so it's a multifaceted engineering problem that our supply chain team's working on. But we have Six Sigma black belts in supply chain analysis, and we have amazing mechanical and electrical and software engineers who can redesign and rework. And so, look, there were constraints. We were constrained in this December quarter we just announced. We grew at 16% on devices, 12% over the whole business, but we were constrained. It would have been even higher growth if we had more supply. What I said is in the March quarter, which is our fiscal Q3, that's going to get better, but then it gets even better in the June quarter. June 2022 quarter, which is our Q4 fiscal. We think that a lot of the projects we started June last year when our competitor announced their recall, that we started those re-engineering projects, they're going to start to come to fruition in Q4, so in that June quarter. And then as we look to September and December, our competitor will still be out. We're really going to see an increase in the supply. You asked how we did it. The answer is, amazing engineers, amazing supply chain people. Andrew Price is my president of global operations. Linda Laidlaw, she leads my global supply chain team. Those two together with teams of, I run out of fingers and toes counting the amazing engineers and scientists working on this. But I can tell you, as they partnered with our hundreds of suppliers, have found ways in the midst of a COVID crisis, in the midst of a supply chain crisis, and then thrown on with this infinite almost demand for 12, 18 months. We've found ways to get there with 16% growth of the devices in the last quarter. It's just going to get better as we go through the calendar year. So although we're constrained and costs have gone up, as you said, there's been weighing on our gross margin because sea freight is 5 times the cost that it used to be. There are ships backed up on Long Beach, South Carolina, Eindhoven in Europe and all across the world. So we're having to air freight. Josh, we had to pull out the seats and put CPAPs, APAPs, and bilevels in commercial jets, Air Canada, Egypt Air. These were sitting on the runway in Singapore because no one's flying all around the world. We reconfigured them and we're air freighting CPAPs, APAPs, and bilevels to Los Angeles, to Atlanta, our major distribution for the US. So our costs have gone up. What are we doing? Well, look, we're introducing new products, and those that are at a price premium, the Essence 11. We also introduced a surcharge just here in January, a $12 surcharge on all devices, 12 euros for Europe, because our costs have gone up so much. We have to share some of that with our customers. Those customers are seeing the price of milk and bread and gasoline go up, so they know that prices are going up. We're not raising prices because we're in healthcare, but we are putting a temporary surcharge that will be up as long as our costs are up. But look, we're mitigating the crisis, we're freeing up supply, and I think as we get to March, it gets better. June, it gets even better. And as we move through this calendar year, ResMed's going to take care of more and more and more of those patients in the backlog for getting care for their sleep apnea, their COPD, their asthma, and their other out-of-hospital needs.
Transitioning to some acquisitions you've made last quarter in October, you guys closed a transaction to acquire Ectosense, a leader in cloud-connected home sleep apnea testing technology from Belgium. And then you were quoted as saying that RMD is set up for sustainable growth through ongoing innovation investments, commercial excellence, partnerships, and future acceleration through strategic M&As, as well as selective tuck-in M&A opportunities. When you're looking at these, Mick, what are you actually looking for when trying to select potential partners for M&As?
Yeah, Josh, it's a great question because look, ResMed has had such organic growth, and as we've been speaking, in the first parts of this discussion we've been having, our biggest opportunity is organic growth because there's 1 billion people with sleep apnea almost, and 1.5 billion when you include the COPD and asthma patients out there. 1 in 5 people on the planet. So organic growth, huge part of our driver, and incredible as we saw 12% growth in the December quarter. But here at ResMed, we don't just accept that current market and current market growth. We look at great opportunities for strategic M&A and tuck-in M&A, as your question alluded to. We've made some great strategic M&A. We bought a company called Brightree back in 2016, which at the time, our market cap at the time was around 8 billion. And we bought this company, Brightree, for 800 million. And so that was 10% of our market cap back in 2016. And people said, wow, ResMed's doing this step-out acquisition, this strategic M&A into software as a service. Is ResMed going to be able, they can manage cloud software and medical software around their core sleep apnea and COPD platform. Can they really manage an out-of-hospital SaaS business in home medical equipment? Well, it turns out 5 years later, actually it's going to be 6 years come next month, we've done a pretty good job. We've grown that franchise. We're now the #1 provider of home medical equipment software as a service, and it's growing incredibly well. Our SaaS group grew at 8% in the last quarter. The Brightree team, which is that acquisition, is even ahead of that group growth in SaaS. So really beautiful example of strategic M&A that's been successful. We added in Matrix Care there as well and a Healthcare First, and so that SaaS portfolio has grown incredibly well. We've also done some good tuck-in acquisitions. I look at Snap Technology. This is a tuck-in acquisition, Josh, that we made. It's resupply technology to encourage people to get more masks, more accessories as appropriate, and you need to clean your CPAP device. And actually COVID-19 showed people the importance of respiratory health and respiratory hygiene. I mean, COVID-19 is a communicable respiratory disease. Having a clean CPAP mask was always important, but COVID-19 helped people realize to do that's more important. That tuck-in M&A called Snap, we closed it at February 2020, just before COVID really took off. That helped us drive resupply for our customers in home medical equipment, but also our SaaS division really well. So good example of strategic M&A with Brightree and tuck-in M&A with Snap. Looking forward, obviously I'm not going to go into the examples of our pipeline and the M&A we're looking at, but what I look for as we look for M&A is a couple of factors. Number one is it's a strategic link to ResMed's business. So is it going to help people sleep better, breathe better, and live better lives outside the hospital? Linked to our strategy to help 250 million people sleep better, breathe better, and live better lives by 2025. So that's number one. Does it meet our strategy for ResMed 2025? Criteria number two is that it has to be a great financial fit. We have to be the best financial owner of this asset. So if it's owned by private equity or VC or a public company, are we going to be better? Is it going to grow better and be better with ResMed as the financial owner? So that's really important. Does the numbers pan out? The NPV, the Monte Carlo simulation, the DCF, is it better in our hands than the current owners? And thirdly, and this is really important, is there a cultural fit? Are these people ResMedians? Because once we acquire the company, they become ResMedians. They become part of the ResMed team. So are they committed to honesty, integrity, doing the right thing? Are they committed to helping people in out-of-hospital care and linked to all the approaches that we have in medtech and really transforming the market that we're in? And so, look, we look at a lot of opportunities, but it gets, you look at the funnel and it gets smaller and smaller. Does it meet our strategy? Are we the best owner of this asset? And are these people the right cultural fit for ResMed? But when those three criteria are there and it fits within our approach, we go and make that M&A. And without telegraphing anything, I can tell you we've got a lot of cash. We've got a lot of free cash flow. We've got a 30+ billion market cap. And so we've got access to debt, equity, and the ability to make acquisitions. There are some interesting models out there. Some of the valuations are a little frothy, but as things start to come within our zone on that number two, the financial one, I think you'll see ResMed continue to do great tuck-in M&A and appropriate strategic M&A to continue the great growth we've had over the last 5 years.
Let's take a look at how some of the products and partnerships have added to that top line revenue growth. Looking at ResMed's market cap, 38 billion. Q1 fiscal year 2022. Company results beat Wall Street estimates for both revenue and profit, driven by high demand for the company's sleep and respiratory care products. ResMed revenues totaled $904 million, a 19% increase compared to the year prior, beating analyst estimates by $45.8 million. I think your device growth, you mentioned 16% year over year growth. Having said all of that, what is the biggest driver? Is it the sleep apnea, or which part of the business is the largest driver for your growth moving forward into 2023 and beyond?
Yeah, Josh, it's a good question because we have actually a portfolio of great growth businesses. The core sleep apnea market, with 1 billion patients out there, could grow, and that could keep many other companies happy just alone. But I look at that and say, look, if we've got, before COVID, we were seeing mid-single digit growth in the device part of that sleep apnea market and high single digit growth in the mask side. We always at ResMed said, well, let's not just accept that market growth. Let's drive more demand gen. And so we're doing that through digital means, as I talked about, our partnership with Verily called Primasum. We're doing it through brick and mortar means in our partnership with CVS Health. We're also doing it through core social media and marketing approaches to drive that core growth of our sleep apnea business. But we want to do more than that. So we've moved into COPD. We have our non-invasive ventilation and our life support ventilation in there already. We bought a company called Propeller just about 3 years ago, just at the start of 2019. Those are cloud-connected medical devices for the inhaled medicines that patients with COPD and asthma need. What that does is it gets us into a broader market for COPD patients, not just stage 3, stage 4 patients with our ventilators, but stage 1 and stage 2 patients who need these cloud-connected medical devices and the drugs that they can get into their lungs to help them breathe better and live better lives. And so that's an expansion of our COPD business. In addition to that, as I mentioned earlier, we purchased Brightree and got us into the software as a service business, and that's growing really well. We added on Matrix Care on the M&A side, and we have really good organic growth there, but I could see some interesting M&A, in different segments and different geographies to keep that growing. So I know you asked me, is the growth sleep apnea, is the growth COPD, or is the growth SaaS, which is going to grow? The answer, Josh, it was almost a false dichotomy to say, is it A or B? It's yes, we're going to grow in sleep apnea. Yes, we're going to grow in COPD. And yes, we're going to grow in SaaS. And ResMed has 3 strong growth businesses that on their own have good organic growth. Our job is not just to accept market growth. We want to meet or beat that, taking share and expanding the market. As I said, with 1.6 billion patients worldwide, the biggest opportunity is to expand the market, but also taking share. We like the competitive game, and we have been taking share in our core market. Before this recall, we were the number 1 provider, and we're taking share from our competitor. We're doing the same in our COPD business and in the software as a service business. We've got some good, strong competitors out there, but we're the only strategic player. We're taking good share, and I think we have a right to be the number 1 provider of out-of-hospital care and help 250 million people sleep better, breathe better, and live better lives in 2025. That's our strategy.
Looking how that revenue translates into stock valuations, you guys were recently upgraded by an analyst, and looking at the last 2 years, at least, RMD's beaten the earnings per share estimates 100% of the time over the last 3 months. EPS estimates have seen 3 upward revisions, 1 down, and looks like the company's shares have gained more than 25% year to date. In the last year, ResMed's stock prices increased by 18%. Mick, what would you say is the reason ResMed's stock continues to perform well despite challenges in the industry?
Well, Josh, we're in a very volatile market right now. I mean, we all saw Netflix, they missed growth by a couple of percentage points and their stock went down 20%. And so it's a volatile market. And we just put out our numbers yesterday. And I think there's been actually, a slight reduction in our stock just today. But to your point and your question, if you look back on a 1 year, 3 year, and 5 year basis, ResMed's total shareholder return has been extraordinary. Double digits in the 1 year, triple digits, really strong triple digits in the 3 year and 5 year total shareholder return. And we do that because we focus on the long term. So despite short-term volatility around people worried about interest rates or inflation and the economy moving up and down, ResMed has been a really strong long-term provider of care. It's because we're in big markets, we're the number one provider in most of them, and we're growing with market and ahead of market, but we also reinvent markets and transform them, as we talked about, the digital transformation of sleep apnea, the digital transformation of COPD, and the digital transformation of software as a service in out-of-hospital care. So, the question was, how do we maintain, how do we achieve that great total shareholder return? It's through executing well in all those markets. And as I look forward to 2025, the big markets are still there. We're still a leading provider, and we're still innovating ahead of the curve. And we have the opportunity for double-digit growth in the number of patients in our ecosystem to achieve our goal of 250 million lives changed by 2025. And we're going to maintain that. We've also maintained pretty good fiscal discipline, Josh. And I think, we've been able to lower SG&A as a percentage of our revenues. And so we've found ways to make things more efficient. COVID-19 has forced a lot of that in terms of people going remote, working remote, traveling less, and that's great because it saves on costs, and we only travel when we have to, and there's a purpose, and getting together with those doctors or those customers is really important. So I think SG&A reduction and efficiencies are good. We've maintained our R&D investments, Josh. We invest 7% of our total global revenues back into R&D. Software engineering, mechanical engineering, electrical engineering, digital health technology scientists, AI and ML to transform big data into actionable outcomes for consumers, patients, providers, physicians, and across the healthcare system. So I put all that together and say, look, our 1 year, 3 year, and 5 year total shareholder return is great. We don't focus on the short-term ups and downs of the market and the money flow. We know we've got great free cash flow. We reinvest it in the business. We do have a dividend, so we are able to achieve, approximately 2% extra for our total shareholder return for our shareholders, give some cash back to them through dividends. But most importantly, we reinvest in our business, we drive innovation, we change the world in big markets, in underserved markets. And, I think we're at mile one of a marathon in digital health. ResMed's the fittest and the best in the medtech breed, and we're ahead of our competition. But I'm productively paranoid, making sure we're fit, doing great miles, every mile for this marathon, and keep us in the front to make sure that, Josh, if we talk in 1 year or 3 years' time from now, we see the same sort of total shareholder return historically that we're going to be able to achieve for the future.
Talk to me about 2025 then, Mick. What lies ahead for the industry and patients, and what are a couple of goals you have in order to keep your advantages that you have by 2025?
Yeah, well, look, to get to that ambitious goal, if you take the last 12 months, we changed 133 million lives in the last 12 months. And, that's more than 15, 16 million of them with a hardware device, either a CPAP, an APAP, a bi-level, a ventilator, or a full mask system in our sleep apnea, COPD, and asthma business. And over 100 million lives that we changed with the digital health product, either an app like myAir, or a solution like Brightree helping home medical equipment patients, or a solution like Matrix Care helping people in home health, hospice, nursing homes, skilled nursing facilities, and life plan communities. So to get from 133 million lives in the last 12 months in just the next 4 years to get all the way up to 250 million lives, which is our goal for 2025, that's ambitious growth. It's double-digit growth of the number of lives we transform. So how are we going to achieve that? Well, we're going to identify, engage, and enroll more patients in our core markets of sleep apnea. We're going to identify, engage, and enroll more patients in our new markets of COPD and asthma treatment. And we're going to work with our software as a service and our digital health solutions to scale them across the US and around the world to take care of more lives, to improve more lives, to lower costs, and improve healthcare outcomes. A lot of that will be our direct work with our partners in the channel. Some of it will be partnering with governments on helping them understand this public health crisis that is sleep apnea and lung disease, and how important it is for people to age in place. We have populations that are getting older and getting fatter as a group, right? BMI is going up on average, and age is going up on average. Sadly, that means more sleep apnea, more COPD, and more asthma patients. It also means more patients that will want to stay in their home and have medical care in their home, or at least have home health, private duty home care, hospice care, skilled nursing facility, nursing home care. Out of hospital healthcare is what we call the market. That's 90 to 95% of ResMed's revenues and profits are in out-of-hospital healthcare. We think that's the future. That's where ResMed's betting. It's where we think hospital systems should bet, healthcare systems should bet, to not have people at the emergency room, the ICU, the CCU, but to take care of them with preventative care, preferably in their own home. So that's what we're looking for. That's where we're investing. And that's why I think ResMed's perfectly positioned to be able to achieve our goals for 2025. It's ambitious, but we can get there with those global trends, but also our ability to execute.
All right. I think with that, we're going to have to wrap this one up. So I want to thank my guest, Mick Farrell, CEO of ResMed. Mick, thanks for being with us at CEO Interviews.
Josh, thanks a lot. Great to talk with you, and look forward to seeing the program.
Thanks, Mick. I'm Josh Kincaid. This has been another CEO Interviews by Seeking Alpha. Don't forget to like, share, and subscribe. Thanks.